88% of Americans are at risk of chronic disease and premature death, and you know what? They aren't even aware of this. I am seeing this more and more on a daily basis in the emergency department, and I want to help make you more aware. So I'm seeing patients that are diagnosed with hypertension and started on medications that don't believe that there's an issue because they are taking medication. I am also seeing young people coming into the emergency department and suffering from stroke and heart attack without a warning sign. I'm seeing individuals with polycystic ovarian syndrome, erectile dysfunction at super young ages. Okay, so this is tragic. But what's even more tragic is the fact that most of these chronic diseases and these sudden cases of death could have been prevented. We're so used to chronic diseases and suffering from illness that we're beginning to accept this as normal, okay? We can overcome this. These illnesses are secondary to poor lifestyle choices, okay? Our lifestyle choices, they're killing us. Do you guys know that more than 50% of Americans suffer from at least one chronic disease? Okay, and this is the problem because there's a shortage of physicians and providers to care for us. So most of the practicing providers are spending all of their time taking care of sick patients, and they're doing little to no education on prevention. And also, we as a medical community, we're doing something dramatically wrong. I am still hearing my colleagues recommending a low-calorie, low-fat diet. This is not where things are at. Okay, very few providers have taken it upon themselves to learn about metabolic health. You know, they're still reaching back to their medical training 20 years ago and recommending these things. Guys, my name, if you don't know me, is Amanda Brooks. I'm a practicing physician assistant. I've practiced emergency medicine for going on 20 years. And I've really taken the liberty upon myself to do additional research so I can provide you with information that will not only help you, but will help you to help others. Okay, so like I said, my colleagues, they're blaming genetics. They're not taking the time to educate. So I think it's very important that we all, as individuals, align ourselves with someone who is willing to take the time with us. This video today is going to discuss metabolic health because, like I said before, only 12% of us are metabolically healthy. Do you want to see if you fit into that category? Guys, 8 out of 10 of the top reasons for death in the United States are due to metabolic syndrome. Metabolic syndrome is a combination of obesity, hypertension, diabetes, which results in chronic disease like stroke, like heart attack. So what I'm saying here is 8 out of 10 of the top reasons for death are completely preventable. So get out your notebook, and these are the 5 markers that I want you to assess to see if you are metabolically healthy or metabolically unhealthy. And if you're metabolically unhealthy, again, please align yourself with someone. Make sure to follow me here on YouTube so that you can get these helpful videos to improve your health. But align yourself with a provider that will help you. And if you're interested in aligning with me, you can go to yourwellnessally.com and book a consult. But the first is waist circumference. Okay, so if you first get up in the morning and take your measurement with a flexible measurer, I have a cloth tape measurer just above your navel before you start your day. For women, your waist circumference needs to be 35 or under. For males, it needs to be 40 and under. This is a marker of our visceral fat, the fat that's surrounding our organs. which is extremely detrimental to our health, can contribute to fatty liver and polycystic ovarian syndrome, all sorts of other health conditions. Number 2, you want your fasting glucose under 100. What I'm seeing lately is more and more young people are having hyperglycemia. This is also showing us that your insulin levels are all over the place. Hyperinsulinemia, so increased production of insulin, is not a good thing either. So number 2, your fasting glucose needs to be under 100. Number 3, we need to look at your blood pressure. It needs to be under 135/80. And I'm not talking about under those numbers and taking a blood pressure medicine. If you are already on a blood pressure medicine, you are metabolically unhealthy. Same thing if you are on a glucose lowering agent. You are already metabolically unhealthy because your sugar is being lowered by a pharmaceutical. So these numbers are for the individual that is not taking any medication. Okay, so again, blood pressure below 135/80. We see that blood pressure is a very strong predictor of poor metabolic health. As soon as that number starts to creep up, it means that a lot of other things are going awry in the human body. Number 4, we need to look at your cholesterol panel. And the 2 numbers that I'm concerned about, guys, are triglycerides. These need to be under 150, which I think is liberal. So triglycerides under 150, and HDL for men needs to be over 40, and for women needs to be over 50. So notice that I'm not even addressing LDL in this conversation. Okay, so I want you to, first of all, become aware. Are you or are you not metabolically healthy? If you are metabolically healthy per these measurements, but are still confused as to what it is you need to be doing, continue to follow me. We're going to talk about these things in more depth. And if you aren't metabolically healthy, if you're part of the 88% of Americans that are not healthy, please have this, or let this be a wake-up call and start to take your health into your own hands, because no one's going to do it for you. Hope you found this helpful. Please like, subscribe, follow me here on YouTube, and I look forward to providing you with more helpful information.